Welcome to Healthcare IT Today. I'm John Lynn, together with my colleague and friend Colin. The world of technology and healthcare are ever changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. Today, we're going to be doing a preview of the upcoming HFMA annual conference in Las Vegas. And be sure to follow the show on social media at the hashtag HITSM and our personal accounts at TechGuy and at Colin_Hung. Plus, check out our 18 years of health IT blog content at healthcareittoday.com. You ready to go back to Vegas again?
I am always ready to come to Vegas, John, because then it gives us a chance to hang out.
Well, okay, set me aside. Are you sick of Vegas? Be real, not just me.
No, no. Actually, Vegas is one of those cities where every time I go, I discover something new, right? And it's such good eating in Vegas. So I'm a foodie. So I actually don't mind Vegas. So yeah, I do look forward to whenever I'm there. I don't gamble anymore.
I was gonna say, when's the last time you gambled in Vegas? Right,
that's probably about. I'm gonna be honest. That's probably about 3 years ago. Is the last time I put money down on a table.
Sooner than I thought, actually. But when's the last time you went to a club? Have you been to a club?
Well, that wasn't part of a conference. Probably it's been a long time. Yes.
Well, I mean that's what's so interesting, right? People are like, "Oh, Vegas, I can't do it." It's like, well, you do Vegas a little different than some people, right? A lot of people that I know that come for the conference literally do just come for the conference, and then, like you said, they just want a nice restaurant, easy access, right? They're not gambling, they're not doing the other stuff. So, I mean, I get people that are doing that. Maybe you don't want to come to Vegas a lot.
Well, but also another reason, it's the final conference in the spring conference season this year. And so I'm looking forward to that, because after that, it's pretty much a gap for a few months, which I'm looking forward to.
That's interesting you bring that up, because I don't feel like there's much gap. I think I have 4 conferences in June. July, I'm not sure I have a conference. So that's the gap maybe. But in August, there's a couple more already. So starting with Epic UGM. So Epic needs to move to the fall and stop ruining our summers.
Anyways, yeah, this is gonna be fun. I'm looking forward to it. I haven't been to HFMA in a long time, and actually that's leads me to my first question for you, John. What do you think actually is going to be the biggest topic of discussion at the HFMA conference at the end of June?
Yeah, I think there's one topic that's going to rule all, and you think I'm going to say AI, but I'm not. It's actually Change Healthcare. What happened with Change Healthcare is going to be the topic du jour. It's going to be what's talked about in the hallways. It's going to be an overtone of every discussion that happens. It's going to be interesting. I'm actually really excited for it, because I wanted to hear what they're saying about redundancy, what they're saying about switching, different providers that they're using for RCM. Those are going to be really challenging topics, especially the redundancy one, and understanding how do we create a more resilient RCM, platform and reimbursement framework. Yeah, that's going to be a really big topic, and I think everyone's going to be talking about it.
Yeah, I mean, it's hard to argue, John. I agree. I mean, at HFMA, I think change is going to be the topic du jour for sure. It's very interesting how that one incident has really spawned 2 conversations for me, that I'm here about. One, it is about the redundancy and the backup and the whole cybersecurity. So it's brought that into focus. Not that we needed any more focus on it, but certainly that one, because it took down so much of the infrastructure. But the other one for me, it's really more the education now that happened almost overnight for providers to start asking questions of, do you use change in the background, right? So it's spawned this whole set of questioning that I think people really didn't think about too much, which is the risk of the vendors, right, and the vendors' partners. And so taking that risk assessment down another level, this has really highlighted the fact that the providers really have to do that in order to truly get redundancy, right? Because I think, as you've mentioned a few times, I think providers thought they were being smart and chose 2 or 3 different people to maybe do their processing, but it turns out those 3 are actually in the behind the scenes, all using the same vendor. So you really didn't get as much redundancy as you thought. So I think that'll be definitely a topic of discussion at the conference in June.
I think the challenge with this is that we've actually talked about layers of risk. A lot of people talked about that. Hey, I contract with my EHR vendor, but who are the third parties that they're using? And so that has been a topic of discussion for quite a while, but only in the framework of security and privacy and the risk that way. And so we have talked about this, third party, fourth party, fifth party vendors, right? Like that language is normal in healthcare and something we've talked a lot about. But I think to your point, which I think you're trying to say, is that like we haven't talked about it from a revenue standpoint. Like, is our revenue dependent on these third party vendors? And if they go down, what does that mean? So I think that's such a different conversation than we've had previously. We just assumed it worked. Which, I mean, let's give some credit. Like the infrastructure was quite robust. This is the first time we've talked about it, and it wasn't an issue before in a major way. So that, I mean, I guess there's something to say about that. And change can send a thank you note and some flowers to Ascension, who's going to take a little bit of the Ascension breach is going to take a little bit off the Change Healthcare back. And to be fair, also every provider at HFMA and every vendor at HFMA, they're not going to be too hard on Change either, because they know that they could happen to them as well. So, I think people are going to be a little cautious, pointing the finger, but it's not going to be so much about blame and what an awful organization it is. It's going to be, wow, this could be us. What does that mean for us?
Yeah, and I think that's the other thing, and excuse the pun, right? I think that's the change in tone about the conversation. I think we've moved past the what happened, who was to blame, what didn't happen, when is this going to happen again, and now towards more of, okay, how do we recover so that so when it happens again, it's faster this time, right? We're not down for months or weeks. We don't have to, give financial aid to support organizations who couldn't get paid. I think the questions are now going, what's around that? What are we doing differently this time around? And I think that's going to be a good thing, because I think we need to get there faster. So because because all we could talk about for the longest time was the recovery process, because it was taking so long to recover from this and the financial implications of it. So hopefully by the end of June we're past those parts and really can move to the, okay, what's going to be different.
Yeah. Colin, you said something about excuse the pun. On this show, we don't excuse the pun, we embrace the pun.
You embrace the
So
puns?
that
Okay. It's accepted.
So Colin, tell me though, what do you think we're going to see at HFMA around AI? I kind of prefaced the AI is going to be hot too. So, what do you think we're going to see there at HFMA and AI?
Well, I think the momentum behind automated coding and the potential of using AI for that is going to be well on display at HFMA. I'm still a little skeptical of this technology, not in terms of, I know it eventually will work, but I just wonder, I'm skeptical how many people will actually want to adopt this fully, right? I think it's still got to be in a co-pilot, which is, I think, how most vendors are rolling it out anyways. But I'm going to be very interested to see how much progress has been made around this automated coding and where people are applying it. In the past, people have applied it to certain types of practices or certain types of specialties and not others. Maybe it's more general now. So I'm excited to kind of look at that aspect of AI and RCM, and I think that's going to be a hot topic at HFMA. What about you?
Yeah, I mean, what's interesting is that I'm not sure AI is going to have nearly the impact of HFMA at HFMA versus some of the other health IT conferences, clinical conferences, et cetera. And the reason for that is that I think most of the solutions at HFMA are actually going to be more like robotic process automation and analytics that then drive some sort of process or something like that, versus when you look at the Gen AI, for example, which is what's been so exciting across so many areas. Sure, there is the medical coding piece that is potential there, but like, are you going to generate a generative AI payment, invoice or whatever they're called, statement for the patient? Probably not, right? But could you explain the bill a little bit more? Maybe, maybe there's some generative AI there that you could do. But yeah, like I just don't think it's going to be the AI and the generative AI that we see so much in the clinical area, creating notes, creating letters, creating information for the patients, summarizing it in a way that's better for them. Like we see that all over the clinical. On the RCM space, I think it's more about how am I going to process, low balances? Well, that's not really an AI problem. It is an automation problem. So how can I automate the outreach? And maybe there's a chatbot that's going to answer some questions based on the patient's history. So I guess that could be an element of AI. They're, answering the patient's questions in a way that's more interesting in some sort of chatbot style answer to the question versus, calling into the office. So maybe there's some things there, but you look across the others, I just don't see as much AI excitement around RCM versus the, even some machine learning stuff, right? About knowing what should you charge up front to a patient, and are they going to be able to pay if I do this procedure or not? That's still more machine learning and analytics versus AI.
You're not wrong. I think RCM itself, has never been at the forefront except when something happened, right? It was a back office function, and it just worked for the most part, right? Like everyone knew what they were doing, and it was kind of just on the rails, so to speak. So you're right. I think AI really isn't going to have the excitement level of, let's say, doing something like ambient clinical voice where you're taking the notes, right? But I do think there's some areas that are pretty exciting, like the one I mentioned, automated coding. I think could be a big thing. I also think that you alluded to it there, John. Like applying AI and machine learning more likely to figuring out which patients may have a propensity to pay issue, right? And knowing that upfront, maybe you can offer some financial assistance up front, or maybe make them aware of the different options up front, and that will increase the amount you can bring in, right? Increase the likelihood of that revenue. So I do think there's some interesting sort of small niche areas like that could be exciting if you're in this space particularly, but you're right at the general level. I mean, this is not really going to move the needle in terms of like ambient clinical voice does in the clinical side.
Yeah. And it will be interesting to see. Maybe there are some creative ones, right? I mean, that's the beauty of this Gen AI is that it's been applied so many different places. And when you're steeped in what's happening with RCM, maybe you will discover, maybe it's letters to the insurance companies that need to be done, right? I mean, that could be a really interesting place that we see some generative AI applied because they're like the letter that the doctor has to write to get the pre-approval for the whatever, right? Or the denial letter that needs to be sent to the insurance company to be able to, reach out about a denial. That could be. So I guess that would be one area maybe as well, interacting with the insurance company, using Gen AI where they're using it on the back end so that robots talking to robot, that could be happening.
We actually had that discussion recently at a conference where like, what happens when two chatbots decide to get together, right? Where the chatbot's submitting something and then there's a response and then they end up talking to each other and trying to resolve the issue. But is that Skynet? But anyway, it's going to be interesting because it's going to
Request the
happen.
cancellation 10 times, or the charge happens 10 times because of the bot that charged itself, or I guess it could be 1,000 times with the bot, just gets in a loop.
Who knows what's going to happen? We'll definitely be writing about that story when that happens. Hey, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and Colin Hung. Today, we're previewing the HFMA annual conference happening at the end of June in Las Vegas. And by the way, if you're going to be there and are interested in doing a video, maybe a testimonial with your customer, or perhaps you're a subject matter expert at your company and you want to get them highlighted, contact John and I. We're both going to be there, and we're happy to do some videos and explore doing those videos with you. So, John, let me ask you this. We talk a lot about AI, and I think we're past the hype, the highest point of the hype of AI, but where are you seeing AI, machine learning, and automation really having an impact in the RCM space?
Yeah. I mean, what's interesting, and this may be actually one of the things I'm most excited to see at the conference is FinThrive put together an AI maturity model. And I'm interested to dive more into that and see, what have they found? Because I think it was last year they announced it, if I remember right. We did a video with them talking about it, and I'm interested to know. Okay, a year later, one, where is that maturity model? How is the maturity model matured? Like, because when you roll something like that, people come to you and say, well, what about this? What about this? And so it can improve as well. So if I were to look across and like, okay, well, are we seeing a lot of impact? I'm interested in seeing, how how are denials being addressed using automation? I feel like, we look at the payer side, and the payers are using automation in a massive way. In fact, we know about stories of that. Our friend Dr. Nick has one where it's denied automatically, and you're like, wait a minute, this isn't right. Like, and we even read stories about that from, different publications talking about payers that they have to deny a certain percentage, which is awful and unethical and all sorts of things, right? But like, can we do something about helping provider organizations be able to, appeal those denials? But I think also, related to that is using the technology and the data inside the EHR, the data from the patient, whoever else it might be needed, and use that data to improve first that it doesn't get denied, and then second, if it is denied, to use automation and AI and understanding what's in the note, what's in the EHR, and even outreach to the providers in a way to be able to get the information that's needed so that the appeal could be done automatically. I think that's kind of like that full circle automation that I'm interested to see.
Yeah, it's kind of funny, John. I asked this exact question in an interview I did with Michael Quinn over at Inovalon. We did one of those 3 tough question interviews I did with him, and I asked him this question about where does he seeing a meaningful application of RCM, and he pointed to what you just mentioned, John, before. The use of AI potentially to do some really unique analytics on the data available to you in the RCM world got him excited. And what he meant by that was, finding patterns that maybe not as obvious to a human being as to why certain claims were getting denied, as to why certain patients were or were not paying, and what you can do to maybe improve or replicate that, right? Like, why is it that these patients are always paying all the time, on time, never late? What are they doing different? What are we doing differently to them? Is it the reminder? Is it something else? AI applied to the analytics side could be really exciting and a really great way of using it. And it's not something that we talk about a lot, right? It's a lot more around the automated coding and so forth. Also, you know, back to something before, I think one of the biggest impacts that AI to me will have is actually relieving some of the staffing issues that still seem to be a problem for a lot of organizations. I literally last week I was at the eClinicalWorks summit, and I must have talked to about 6 people who said they can't find and keep RCM folks, coders at all, because they keep getting poached. Is what he was saying, is because he was in a small market. There's only about 10 or 12 of them that live in the town. And they're saying like they're all getting poached. And every time they get poached, they get higher and higher salary. And so they can't afford them anymore. And so having a tool like an AI supplement the existing of people, it just allows them to continue to function. And so
Yeah.
I'm certainly excited for that aspect of AI. And I think that's where we're going to have that's where it's going to have a meaningful impact.
Yeah, I mean, I was fascinated at the TrueBridge user conference recently, and I kind of leaned over to my contact there, and I'm like, "Hey, is TrueBridge an EHR vendor, or are they an RCM company?" And when you hear them on stage and they talk about, I mean, I forget hundreds. I want to say they said 1,000 RCM coders in their organization. And I mean, like they have massive people doing all the coding because in rural health they have a challenge keeping it right, and especially at scale, or they don't want to live in that rural environment. And so TrueBridge became an RCM company. I think they acquired, but anyway, whatever, how you're going to do it. Like the CPSI is their EHR and got rebranded to TrueBridge, and they have all these RCM coders there, right? And they have a problem. I mean, they even said it on stage. They said, "Hey, it's a challenge for us to get coders just like you." Like, we have open positions, you do too. And so I think you're right. We need AI to help supplement some of that. So that would be interesting to talk with TrueBridge at the event and see what they're doing AI wise, especially because they do have the EHR where they can apply it directly. So I think that's fascinating. There's another one you mentioned ambient clinical voice even before I did, so I don't know what that means, but ambience healthcare is there, and you're like, well, why is ambient clinical voice there? But when you talk to people like ambience healthcare, part of the ambient clinical voice is doing the coding. That's part of the value proposition that they think is really important. And so it's not too surprising that they would show up at an HFMA conference when what you're doing is you're going to be doing all the coding as part of the ambient clinical voice. And so how that's going to play out and how that's going to show up at HFMA this year is going to be really interesting to see, because that is one of the potential opportunities that where we see AI making a real impact. Now, of course, they're doing the coding and then they want someone to approve it. They want the doctor to go in and approve it and the biller, et cetera. So it's still Copilot, like you mentioned. But anyway, that's going to be interesting to see play out as well.
I know, I totally agree with you, John, and I think it'll be very interesting to see, actually really see and talk to the folks at HFMA where they're seeing a big impact. But let me get to the last question because we don't have a lot of time, and I want to make sure we get to it. Who are you excited to see, John, in the exhibit hall at HFMA? I mean, there are a lot of people that are going to be there, a lot of friends. But are there any companies that you're excited to go visit?
Yeah, I mean, there's so many, right? I loved going and seeing MRO, who's known for doing, the release of information, but definitely has gotten the RCM space in a big way, and they have opportunities. I think Turquoise Health is interesting from a transparency perspective. They're kind of a company that, offers that transparency, and knowing what's going on there is always interesting. Notion Health is another one that I've met with a number of times, and they definitely are working on some innovative things that are interesting across the spectrum. And maybe that's part of it too, right? I'm excited to see what the announcements are. Like who is FinThrive and Waystar and these big conglomerates. Who are they going to chomp up next, right? Like there's got to be a few of those that are going to happen at the conference, let alone Optum, right? They've chomped up all sorts of stuff, right? It'll be interesting to see how they show up. So, I mean, those are a few that, kind of top of mind.
Yeah, I mean, I'm definitely looking forward to seeing what FinThrive has got on the agenda. Our friends over at Novolon, they're always got some interesting modules and more importantly, some interesting partnerships that they are always announcing or forging. So I'm looking forward to meeting with them and catching up with them. Cedar is another company that I'm interested in seeing what they're up to. They've kind of made a big splash in the RCM space recently.
They have
Of
so
course,
much
our friend,
data, right? Like Cedar is
yeah,
interesting because they have so much data that they're always sharing that I think is really interesting.
yeah, their studies and their reports are pretty impressive. Then there's Exolis, of course. It's always fun to visit with them. There's a couple of interesting companies that I wasn't expecting, though. I gotta be honest. Like when I saw them on the list, like SAP is there at HFMA. I'm gonna be
I didn't
interested to
realize
see
that
what
either.
they're there with their Concur product, which I'm not actually that familiar with. So I'm kind of interested to see what that's all about. And then there's our friends Unlock Health. They're there. They have a booth. I'm going to be kind of curious to see what they're up to. Wolters Kluwer's is there. So there's just some companies that I wouldn't have expected to be at HFMA. So I'm curious to see, and visit with them in the exhibit hall just to see why they're there.
Yeah, you even have like Codometrics, Kiwi Tech, longtime AGS Health, longtime people that have been coming. Experian always is interesting, as they try to bridge the consumer gap into healthcare and providing kind of the enterprise product, It's always, yeah, I wonder what they're going to be announcing at the event. I think that's always interesting. And then there's all the consulting companies, right? Like Huron is there. Kaufman always puts out some great reports with information that's interesting. But here was one that I was surprised because I didn't see them at HIMSS, but they are at HFMA and they got a pretty good sized booth, and that's IBM.
Mm.
Is this Watson? I don't know. I don't even know what's left at IBM in healthcare, to be frank. But yeah, I'm interested to see what they do.
Yeah. And I think to your point at the very top with our first question, it will be fun to see what the Optum Change group is going to be doing there. Is it going to be as low key as it was at HIMSS and at Vive? Is it going to be something a little bit more flashy now that we're hopefully going to be merging from that? But yeah, it'll be fun to check all of them out at the exhibit hall.
Yeah, I mean, we'll need both of us to get everyone. I think that's the message here. I think.
That is the message, and that is why I am looking forward to heading down to Las Vegas.
Good stuff.
Well, John, we're at the end of another episode, so thank you to all of you who tuned in to this episode of Healthcare IT Today. You can find out more details about our show by checking out the programs page on healthcarenowradio.com. And please share your voice and engage with the community at healthcareittoday.com and on social media using the hashtag HITSM. I'm Colin Hong, along with my friend and Health IT collaborator, John Lynn. Thanks for listening, and have a great week.